Welcome to the Lawrence County Drug and Alcohol Commission's Naloxone Administration Program Education. Upon successful completion of this free program, you will receive a certificate and free Narcan. We appreciate your interest and your willingness to respond in an emergency situation. My name is Nadine Kirkwood. I am a prevention specialist here at Lawrence County Drug and Alcohol Commission. Additionally, I am a registered nurse, and I have obtained an advanced certification in emergency nursing. Often, naloxone is referred to as Narcan. Narcan and Avizio are brand names. This presentation will mainly focus on the Narcan 4 mg nasal spray. If you wish to obtain Avizio, you will need to contact your healthcare provider, such as your physician or pharmacist. They will provide you with information and training. We will briefly mention Avizio at the end of this presentation. This video reviews when, how, and why to use Narcan. It was created by the National Institutes of Health and National Institute on Drug Abuse.
Naloxone saves lives. No time to sit idly by. More and more people are dying of overdose from the likes of heroin, fentanyl, and prescription pain medications like oxycodone and hydrocodone. These are all examples of opioids. Opioids are drugs derived from the opium poppy plant or made in the lab. They can treat pain, cough, and diarrhea. But opioids can also be addictive and even deadly. The number of opioid overdose deaths has escalated more than 400% since the turn of the century, with tens of thousands of lives now being lost every year. But many deaths can be prevented with a life-saving treatment, naloxone. When given right away, naloxone can work in minutes to reverse an overdose. Naloxone is safe, has few side effects, and some forms can be administered by friends and family. When is naloxone used? You can save a life. First, recognize signs of overdose: limp body, pale clammy face, blue fingernails or lips, vomiting or gurgling sounds, inability to speak or be awakened, slow breathing or heartbeat. If you see these symptoms, call 911 immediately and consider the use of naloxone if available. How is naloxone given? Home preparations include a nasal spray given to someone while they lie on their back, or a device that automatically injects medicine into the thigh. Sometimes, more than one dose is needed. The person's breathing also needs to be monitored. If the person stops breathing, consider rescue breaths and CPR if you are trained, until first responders arrive. How does naloxone work? Naloxone is an opioid antagonist, which means that it blocks opioid receptors from being activated. It is so strongly attracted to the receptors that it knocks other opioids off. When opioids are sitting on their receptors, they change the activity of the cell. Opioid receptors are found on nerve cells all around the body. In the brain, opioids produce feelings of comfort and sleepiness. In the brainstem, opioids relax breathing and reduce cough. In the spinal cord and peripheral nerves, opioids slow down pain signals. In the gastrointestinal tract, opioids are constipating. These opioid actions can be helpful. The body actually produces its own opioids called endorphins, which help calm the body in times of stress. Endorphins help produce the runner's high that helps marathon runners get through grueling races. But opioid drugs, like prescription pain medications or heroin, have much stronger opioid effects, and they're more dangerous. Over time, frequent opioid use makes the body dependent on the drugs. When the opioids are taken away, the body reacts with withdrawal symptoms such as headache, racing heart, soaking sweats, vomiting, diarrhea, and tremors. For many, the symptoms feel unbearable. With continued use, opioid receptors also become less responsive, and the body develops tolerance to the drugs. More drugs are needed to produce the same effects, which makes overdose more likely. Overdose is dangerous, especially for its effect in the brainstem, relaxing breathing. breathing can be relaxed so much that it stops, leading to death. Naloxone knocks opioids off their receptors all around the body. In the brainstem, naloxone can restore the drive to breathe and save a life. But even if naloxone is successful, opioids are still floating around, so expert medical care should be sought as soon as possible. Naloxone works for 30 to 90 minutes before the opioids return to their receptors. Naloxone may promote withdrawal because it knocks opioids off their receptors so quickly. But otherwise, naloxone is safe and unlikely to produce side effects. Naloxone saves lives. From 1996 to 2014, at least 26,500 opioid overdoses in the United States were reversed by laypersons using naloxone. While naloxone is a potentially life-saving treatment, more needs to be done to solve the opioid overdose epidemic. The National Institutes of Health launched the HEAL initiative in 2018, expanding research across multiple NIH institutes and centers to speed scientific solutions to the national opioid crisis. Research is underway to improve treatments for opioid misuse and addiction, and to enhance pain management. The National Institute on Drug Abuse, or NIDA, is a leading NIH institute for research on opioid misuse and addiction, and its support helped the development of the user-friendly naloxone nasal spray. For more information, see NIDA's website at drugabuse.gov and search naloxone, or visit nih.gov and search NIH HEAL Initiative. General opioid information can also be found at medlineplus.gov. This video was produced by Medline Plus, a trusted source of health information from the National Library of Medicine.
The next video contains instructions and administration directions, including signs and symptoms of opioid overdose. Make sure you watch the entire video, as indications for use and important safety information are listed at the end of the video.
If you know someone who takes prescription opioids like Percocet or Oxycontin, or illegal opioids like heroin, then you should know about the risk of an accidental, life-threatening opioid overdose. In fact, over 56% of overdoses happen in private homes beyond the immediate reach of doctors and nurses. There's a way for you to help someone who is experiencing an opioid overdose, even if you don't have specialized medical training. In this video are instructions for use, as well as the uses and safety information you should know for using Narcan. But first, it's important to be able to recognize the signs of an overdose. Signs of an opioid overdose include not waking up or responding to your voice or touch, breathing that is very slow, irregular, or has even stopped. The dark center part of the eyes becomes very small, sometimes called pinpoint pupils. Fingernails and lips turn blue or purple, a slow heartbeat, weak pulse, or low blood pressure. If someone has these signs, here's how you can help. Narcan nasal spray is a medicine that reverses the effects of an opioid overdose. Narcan nasal spray is not a substitute for emergency medical care. Repeated doses may be necessary. As with any drug, you need to be aware of important safety information about its use. Please pay particular attention to the indications and important safety information at the end of this video. Also, please see the accompanying full prescribing information in the use of this product. Narcan nasal spray was designed for use wherever an emergency opioid overdose happens. Because it doesn't require specialized medical training, it can be given to someone by following these instructions. First, lay the person on their back. Then, remove the device from the box and peel back the package. Hold the device with your thumb on the bottom of the plunger and 2 fingers on either side of the nozzle. Tilt the person's head back and provide support under their neck with your hand. Place and hold the tip of the nozzle in one nostril until your fingers touch the bottom of their nose. Press the plunger firmly to give the dose into the person's nose. After giving the dose, remove the device from the person's nostril and move them on their side, positioning their hands under their head. Call 911 and get emergency medical help right away after giving the first dose of Narcan nasal spray, even if the person wakes up. Narcan is not a substitute for emergency medical care. Keep the person under observation. If the person doesn't respond by waking up to voice or touch or breathing normally after 2 to 3 minutes, administer the second dose provided in the box in the alternate nostril. If they respond and the signs of an opioid emergency have returned after Narcan nasal spray is given, then give another dose in the alternate nostril using a new device and watch them closely until emergency help is received. Additional doses may be given every 2 to 3 minutes until they respond or emergency medical help is received. After using Narcan nasal spray, put the device in its box and then dispose in a place safe from children. Narcan nasal spray delivers a consistent, concentrated 4 mg dose of naloxone that can reverse the effects of a life-threatening opioid overdose in minutes. Visit Narcan.com to learn more. There's a way for you to help someone who is experiencing an opioid overdose, even if you don't have specialized medical training. Indications and important safety information. What is Narcan nasal spray? Narcan nasal spray is a prescription medicine used for the treatment of an opioid emergency, such as an overdose or a possible opioid overdose with signs of breathing problems and severe sleepiness or not being able to respond. Narcan nasal spray is to be given right away and does not take the place of emergency medical care. Get emergency medical help right away after giving the first dose of Narcan nasal spray, even if the person wakes up. Narcan nasal spray is safe and effective in children for known or suspected opioid overdose. What is the most important information I should know about Narcan nasal spray? Narcan nasal spray is used to temporarily reverse the effects of opioid medicines. The medicine in Narcan nasal spray has no effect in people who are not taking opioid medicines. Always carry Narcan nasal spray with you in case of an opioid emergency. Use Narcan nasal spray right away if you or your caregiver think signs or symptoms of an opioid emergency are present, even if you are not sure, because an opioid emergency can cause severe injury or death. Signs and symptoms of an opioid emergency may include unusual sleepiness and you are not able to awaken the person with a loud voice or by rubbing firmly on the middle of their chest, breathing problems including slow or shallow breathing and someone difficult to awaken or who looks like they are not breathing. The black circle in the center of the colored part of the eye is very small, sometimes called pinpoint pupils, and someone difficult to awaken. Family members, caregivers, or other people who may have to use Narcan nasal spray in an opioid emergency should know where Narcan nasal spray is stored and how to give Narcan nasal spray before an opioid emergency happens. Get emergency medical help right away after giving the first dose of Narcan nasal spray. Rescue breathing, or CPR, may be given while waiting for emergency medical help. The signs and symptoms of an opioid emergency can return after Narcan nasal spray is given. If this happens, give another dose after 2 to 3 minutes using a new Narcan nasal spray and watch the person until emergency help is received. Who should not use Narcan nasal spray? Do not use Narcan nasal spray if you are allergic to naloxone hydrochloride or any of the ingredients in Narcan nasal spray. What should I tell my healthcare provider before using Narcan nasal spray? Before using Narcan nasal spray, tell your healthcare provider about all of your medical conditions, including if you have heart problems, are pregnant or plan to become pregnant. Use of Narcan nasal spray may cause withdrawal symptoms in your unborn baby. Your unborn baby should be examined by a healthcare provider right away after you use Narcan nasal spray. Are breastfeeding or plan to breastfeed. It is not known if Narcan nasal spray passes into your breast milk. Tell your healthcare provider about the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. What are the possible side effects of Narcan nasal spray? Narcan nasal spray may cause serious side effects including sudden opioid withdrawal symptoms. In someone who has been using opioids regularly, opioid withdrawal symptoms can happen suddenly after receiving Narcan nasal spray and may include body aches, diarrhea, increased heart rate, fever, runny nose, sneezing, goosebumps, sweating, nausea or vomiting, nervousness, restlessness or irritability, shivering or trembling, stomach cramping, weakness, increased blood pressure. In infants under 4 weeks old who have been receiving opioids regularly, sudden opioid withdrawal may be life-threatening if not treated the right way. Signs and symptoms include seizures, crying more than usual, and increased reflexes. These are not all of the possible side effects of Narcan nasal spray. Call your doctor for medical advice about side effects. The risk information provided here is not comprehensive. To learn more, talk about Narcan nasal spray with your healthcare provider or pharmacist. The FDA-approved product labeling can be found at www.narcan.com/pdf/narcan-prescribing-information.pdf or 1-844 for NARCAN. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see full prescribing information, including the patient information for Narcan nasal spray.
All opioids are chemically related. Opioids bind and interact with opioid receptors on the nerve cells in the body and brain, as we just saw in the previous video. Opioid pain relievers are generally safe when taken for a short time as prescribed by a physician. Additionally, if taken differently than prescribed, opioids produce a state of intense happiness and self-confidence. Opioids and opiates do have a place in medical treatment. However, there is always a chance that they may cause dependence even when taken as prescribed. An example of misuse may be when an individual takes the medication other than prescribed, maybe in larger quantity, they may take it more frequently, or in a different route of administration, or the individual may take the medication without a doctor's prescription. Next, we will discuss the difference between opiates and opioids. Opiates come directly from the opium poppy plant. They are strong pain-relieving medications, naturally occurring. Opioids are synthetic or partially synthetic, meaning fully man-made or partially man-made, and additionally, they are also strong pain-relieving medications. We listed some for you here on this slide. You may see opioids and opiates in powdered form, tablets, capsules, within a prescription cough syrup, patches, and injectables. Anyone who takes an opioid risks overdose. The term overdose just means too much. In the context of this presentation, we are discussing when an individual takes a quantity that produces the side effect of respiratory depression, where they stop breathing. Individuals take opioids medically, illicitly, or illegally. Circumstances that increase the risk of overdose include decreased tolerance, taking multiple medications or substances at the same time, or having another illness while taking the opioid. Not everybody who overdoses has a substance use disorder. For example, an elderly individual who can't remember if they took their pain medicine and they don't want that pain to come back and they dose themselves too early. A young person such as an infant or toddler who's just crawling around, going through their world, and comes across an opioid for some reason. A patient who's been released after emergency medical care involving opioid poisoning or intoxication. An individual with a suspected history of illegal or non-medical opioid use, someone prescribed high-dose opioids, or a methadone prescription given to a person who has never used an opioid. Risks for overdose occur when an individual combines their opioid prescription and smoking, if they have lung disease, illness, or obstruction, if they have kidney problems, liver problems, immune system illness, known or suspected alcohol use while using opioids, using these drugs at the same time as opioids, benzodiazepines, SSRIs or selective serotonin reuptake inhibitors, TCA antidepressants, which are tricyclic antidepressants. We will be supplying some supplemental information on SSRIs and TCAs at the end of this presentation. An individual who's developed a decreased tolerance level for opioid or opiates puts themselves at risk for overdose. Examples are prisoners released from custody, releases from opioid detoxification or mandatory abstinence program, whether it's from a hospital or a treatment center, patients in methadone or buprenorphine detox maintenance programs, whether it's for addiction or pain, factors for overdose include mixing street drugs or medications, unknown purity or quantity, or an individual who uses alone. Narcan nasal spray is used to temporarily relieve the effects of opioid medicines. Narcan nasal spray lasts for 30 to 90 minutes. The opioid or opiate that was taken into the system has the potential to last well past 30 to 90 minutes. The medicine in Narcan nasal spray has no effect in people who are not taking opioid medications. Know where Narcan nasal spray is stored and how to give Narcan or Naloxone before the opioid emergency happens. Special considerations for children. Use the adult dose. Read the instructions for use that come with Narcan nasal spray before using it. Actually read them before the emergency occurs. You don't want to be pulling out the instructions and reading them at the time of emergency. So to clarify, you want to read these instructions when you get your Narcan nasal spray. Talk to your healthcare provider if you or your family members or caregivers have questions about the use of Narcan nasal spray. It's very important to remember that this product is only to be used in the nose, thus Narcan nasal spray. Do not remove or test the Narcan nasal spray until you're ready to use it. Each Narcan nasal spray has one dose and cannot be reused. You do not need to prime the Narcan nasal spray. Use Narcan nasal spray right away if you think signs or symptoms of an opioid emergency are present, even if you are not sure. An opioid emergency can cause severe injury or death. CPR is required. Individuals in cardiac arrest from all causes share many signs and symptoms with a narcotic overdose. Unresponsiveness, not breathing, snoring or gurgling sounds, blue skin, blue nail beds. Signs or symptoms of an opioid emergency: a history of current narcotic or opioid use, fentanyl patches on the skin, needle in the body, unresponsive or unconscious individual, not breathing or slow, shallow respirations, snoring or gurgling sounds due to partial upper airway obstruction, pinpoint pupils, the black circle in the center of the colored part of the eye appears very small, blue lips or blue nail beds, clammy skin. Naloxone, otherwise known as Narcan, should not be given or administered if the individual has a known allergy to Narcan, the patient or person is awake, the patient or person is breathing adequately. If you suspect an opioid overdose and the individual is responsive, activate emergency medical services by calling 911. Stay with the individual until emergency medical services or someone with an equal or higher level of training arrives. If the individual is or becomes unresponsive, or you suspect an opioid emergency, shout for help. If someone responds, have them phone emergency medical services, get the first aid kit, Narcan, and AED. You begin CPR. Use the Narcan as soon as it arrives. We'll review Narcan administration in the near future. Reassess and check for breathing. If no one responds to your call for help and the individual is not breathing normally or is only gasping, provide CPR. Perform 5 cycles of CPR, then phone emergency medical services or 911 and get the Narcan first aid kit and AED. Return to the individual and use Narcan. We will review the steps for Narcan administration shortly. Check for responsiveness and breathing. It is important to remember in cardiac and respiratory arrest, CPR is the most important treatment, and any attempt to administer Narcan should not interrupt chest compressions and rescue breathing. If the individual becomes responsive, stop CPR. Stay with the person until medical help arrives. Ensure the safety of the victim. Discourage further use of opioids to relieve withdrawal symptoms. Encourage the person to follow through with medical care. Remember, Narcan is in the individual system for 30 to 90 minutes. Opioids and opiates can be in the system much longer. Have the individual sit or lie comfortably or move the person onto their side. We call this the recovery position. Watch the person closely. If the individual continues to be unresponsive, continue CPR and use the AED as soon as it arrives. Continue CPR and using the AED until someone else arrives who can take turns providing CPR. This individual must be trained in CPR. The person begins to move, speak, blink, or otherwise react. Someone with more advanced training arrives. Using Narcan or Naloxone nasal spray. Step 1. Lay the person on their back. Step 2. Remove Narcan nasal spray from the box. Peel back the tab with the circle to open the Narcan nasal spray. Step 3. Hold the Narcan nasal spray with your thumb on the bottom of the plunger and your first and middle fingers on either side of the nozzle. Step 4. Tilt the person's head back, head tilt chin lift. Gently insert the tip of the nozzle into one nostril until your fingers on either side of the nozzle are against the bottom of the person's nose. Step 5. Press the plunger firmly to give the dose of Narcan nasal spray. Step 6. Remove the Narcan nasal spray from the nostril after giving the dose. Step 7. Ensure that emergency medical services is on the way. If the person does not respond by waking up to voice or touch or breathing normally, another dose may be given in 2 to 3 minutes. Refer to the "if the individual continues to be unresponsive" section. Narcan nasal spray may be dosed every 2 to 3 minutes if available. Repeat steps 2 through 6 using a new Narcan nasal spray to give another dose in the other nostril. Step 8. After use, put the used Narcan nasal spray back into the box. Step 9. Dispose of the used Narcan nasal spray in a place that is away from children. Potential effects after Narcan use. Withdrawal symptoms may occur: seizures, vomiting, agitation, common and serious issues. The individual may become combative. The individual may be disoriented. May cause pain crisis in patients taking medication for a painful illness such as cancer. It is mandatory that anyone receiving Narcan receive medical attention immediately. The overdose may return. Each Narcan dose lasts in a system for 30 to 90 minutes. Opioids may be in the system longer than the Narcan. Stay with the individual until emergency medical services arrive. We need to ensure their safety and discourage further opioid use. The person must be evaluated at the hospital. Even if they seem fine, there may be other problems, and the individual can receive drug and alcohol case management services at the hospital. In summary, emphasis is placed on activation of the emergency medical services, calling 911, initial and ongoing assessment, Narcan administration in combination with CPR when applicable, use of the recovery position, monitor for potential effects of Narcan, and, as we've stated many times, an individual who receives Narcan must be evaluated at the hospital. Documentation. As applicable by first responder protocol. First responders and bystanders should remember to encourage the victim to seek drug and alcohol treatment. At present, Lawrence County Drug and Alcohol Commission offers a ride-along program to our Lawrence County community. So you may see an individual from Lawrence County Drug and Alcohol show up at the scene of a known or suspected overdose situation. You can contact Lawrence County Drug and Alcohol Commission by calling 724-658-5580. You can find additional information at www.ddap.pa.gov. Store Narcan nasal spray at room temperature between 59 degrees Fahrenheit to 77 degrees Fahrenheit, which would be equivalent to 15 degrees Celsius to 25 degrees Celsius. Narcan nasal spray may be stored for short periods up to 104 degrees Fahrenheit, equivalent to 40 degrees Celsius. Do not freeze Narcan nasal spray. Keep Narcan nasal spray in the box until ready to use. Protect Narcan nasal spray from light. Replace Narcan nasal spray before the expiration date on the box. Keep Narcan nasal spray and all medication out of reach of children. If not an overdose situation, using Narcan will not have negative effects. Lawrence County Drug and Alcohol Commission, Inc. can replace a used or expired Narcan kit. Narcan or Naloxone is also available at pharmacies. Unused or expired Narcan or Naloxone kits and any other medication that needs to be disposed of can be done so through the District Attorney's Take Back Program, located at 430 Court Street, Newcastle, PA 16101. Phone number 724-656-1916. In the year 2020, there were 38 confirmed opioid-related overdoses in Lawrence County, Pennsylvania. For more up-to-date information, you can visit Overdose Free PA, which is overdosefreepa.pit.edu. Search Lawrence County, and you'll receive the most up-to-date statistics. Let's highlight some of the services available to the community through Lawrence County Drug and Alcohol Commission. Lawrence County Drug and Alcohol Commission has created a Drug and Alcohol Response Team, or DART for short, that strives to connect those suffering from substance use disorder to a recovery support specialist on site during the emergency situation, such as an overdose. Once the emergency has resolved, the individual and their significant others are given direct access to drug and alcohol services. We offer a variety of other services, including case management, both in-house and out in the community, most specifically at UPMC Jameson and within the Lawrence County Jail. We offer the Student Assistant Program to all of the schools located within Lawrence County. We have a Prevention Education Services Department that also travels to all the schools within Lawrence County and any industry that may need drug and alcohol education. We offer recovery support services, including our recovery center located at Kaufman's Corner. For more information, please feel free to contact us at 724-658-5580 or visit www.lawsca.org. Upon successful completion of this program, you will be prompted on the steps needed to obtain your free course completion certificate and Narcan from Lawrence County Drug and Alcohol Commission. Additional training is also offered at Get Naloxone Now. The link is provided here. There may be a fee associated with the Get Naloxone Now training. The following slides provide supplemental information for Narcan administration and care of the victim. Routes of administration for law enforcement, fire service personnel, and bystanders. As previously discussed within this presentation, Naloxone and Narcan are the intranasal routes of administration. Evizio is the auto-injector. Special considerations for children. Use the adult dose. Evizio should be injected into the muscle or skin of the outer thigh. It can be injected through the clothing if needed. Caregivers should pinch the thigh muscle while injecting Evizio into a child under the age of 1. Once you pull Evizio from the outer case, Evizio has a speaker that provides voice instructions to help guide you through each step of the injection. Here you'll find the American Heart Association's Opioid Associated Emergency for Lay Responders algorithm. Pause the video here if you would like to review the supplemental information. And as always, it is greatly recommended that you attend a formal CPR and/or first aid class. Go ahead and pause the video if you would like to read more in depth about benzodiazepines, SSRIs, or selective serotonin reuptake inhibitors, or TCAs, the tricyclic antidepressants. As highlighted earlier in the presentation, the risk of drug overdose increases when an individual is inputting multiple drugs into their system. Thank you for participating in the Lawrence County Drug and Alcohol Commission's Naloxone Administration Program and increasing your knowledge base, giving yourself the tools needed to successfully respond to an opioid-associated emergency. If we can be of further assistance, please do not hesitate to contact us. Remember, to receive your course completion certificate and receive Narcan, visit the link on the screen, or you can scan your QR code with your mobile device's camera. And thanks again.